She told my father that she had cancer, for which there was no cure. That's a direct quote from a father-in-law recalling the phone call that came right before an absolutely unimaginable tragedy.
So how does something like that even happen? How does a fear, born from just scrolling through videos on a phone, spiral into a real-world catastrophe? Well, that's what we're digging into today. We're going to unpack this one family story to understand a much bigger, growing phenomenon, Cyberchondria, and the really dangerous power of health misinformation online.
Okay, so to really get our heads around the scale of this problem, we have to start with the human cost. And that story begins with a young mother in Rajasthan, India, named Sanju Devi. The facts of what happened on January 11th are just devastating. Sanju Devi, she's a 30-year-old mother. Everyone who knew her, her husband or neighbors, they all said she was so deeply attached to her kids. But she became completely consumed by this terrible fear. See, she was having some health issues, things like mouth ulcers and stomach pain. And that worry just festered and grew until it led to an act that left her entire community, her entire family, just reeling in shock.
So here's the absolute kicker, the thing you have to understand. Her conviction, her certainty that she had cancer, it didn't come from a doctor's diagnosis. It came from her phone. The police investigation pretty quickly found that she'd fallen down one of those digital rabbit holes, just consuming a steady diet of online videos and Instagram reels that all pointed to one conclusion. Her very common symptoms meant she had a terminal illness.
And this is the absolute heart of the tragedy. After everything that happened, a full medical examination was done. The result? No signs of cancer. None. The belief that drove her to do what she did was completely 100% disconnected from her actual physical reality. It's just such a stark, brutal example of the gap between what you see online and actual medical fact. Now, Sanju Devi's story is, thankfully, an extreme case, but it's also a symptom of a much, much larger issue. And that brings us to a condition that experts are recognizing more and more in our digital age. So, what turns a common symptom search into a deadly obsession, right? I mean, this is the real question we need to answer, because let's be honest, we've all done it. You get a headache, you have a weird cough, and what's the first thing you do? You Google it. But at what point does that totally normal, innocent search cross a line and become something far, far more dangerous? Well, researchers actually have a name for this. Cyberchondria. And it's not just, being a little worried about your health. It's specifically this excessive, anxiety-driven online health search. It's a vicious cycle where the search itself ends up making the anxiety way worse, not better.
It's really interesting when you compare this to the older idea of hypochondria, right? Before the internet, your sources of anxiety were pretty limited. Maybe you'd read an article in a magazine or see something on TV. The information was static. But now, with cyberchondria, the content is literally infinite. And here's the most important part, it's personalized. So instead of going to a doctor to get reassurance, you go online and the algorithm actively helps you find evidence that confirms your absolute worst fears. It's a game changer, and not in a good way.
And that right there brings us to the engine that's driving this whole thing. Because it's not just about the information that exists out there on the internet. It's about how that information actively finds you. So how does it work? It's actually a pretty simple but incredibly powerful feedback loop. Step 1, you're scrolling and you watch a video about a health symptom. Maybe you just pause on it for a second. That's all it takes. The algorithm sees that pause and thinks, aha, engagement. So what does it do? It recommends more content just like it. Maybe something a little more extreme or alarming. And then you watch that, which digs the rabbit hole even deeper. It's this compounding effect that creates a totally personalized echo chamber for your deepest anxieties. And you know what's wild? This whole process has gotten so incredibly sophisticated in such a short amount of time. I mean, think about it. Before 2015, your feed was just chronological. You saw what was new. Then it became about engagement. You saw what was popular. But now, we're in the era of AI-powered feeds. The AI isn't just showing you what's popular. It's trying to predict what you specifically want to see, what will keep your eyes glued to the screen. And it's only getting faster. The feed is literally learning and adjusting to your feeds in real time as you scroll. So you have to ask, who's even creating all this content that's fueling these rabbit holes? Well, some researchers at Satyabama Dental College looked into this, specifically for health content on YouTube. And what they found is pretty shocking. A staggering 75% of misleading videos were made by non-professionals. Let that sink in.
The vast majority of the stuff being fed into these powerful algorithms isn't coming from actual experts.
And this creates a huge, fundamental conflict, right? It's a real crisis of trust. On one side, you've got trained medical professionals, and on the other, you have Dr. Google, this endless, algorithmically sorted library of the internet.
And this quote from oncologist Dr. Siddharth Sahai just nails the core issue. He says, "What people don't understand is that it is difficult to say that the internet is completely wrong or right. The point is, real medicine isn't about matching keywords to symptoms. It's about a doctor making a detailed assessment based on your history, an actual physical examination, all the context that an algorithm has absolutely no way of understanding."
I mean, just look at the two paths to a diagnosis side by side. A doctor's method? It's about your patient history, a physical exam, professional training, and putting everything in context. The algorithm's method? It's all about keyword matching, engagement data, and profit-driven metrics. It's literally designed to feed your confirmation bias, not to give you an accurate diagnosis. The two are worlds apart.
Okay, now look at this number, 33%. Just let that sink in for a second.
33% is the number of people in Gen Z who, according to a recent survey, turn to TikTok for health information before they even think about consulting a doctor. This isn't just some niche behavior anymore. It is a massive cultural shift in how we seek out medical information. We're putting our trust in platforms that, let's be real, are not designed with our well-being in mind.
Okay, so we've seen how powerful the technology is, and we've seen that people's behavior is definitely shifting. But the biggest question of all is, why? Why do we fall for it? What is it about our brains that makes us so vulnerable to this stuff? Well, the final piece of this whole puzzle is psychological. There's this great term from a researcher named Hansika Kapoor, black box institutions. Think about something like science, or in this case, medicine. For most of us, they're total black boxes, right? They're these super complex systems where we might see the results on the outside, but we don't really understand how they work on the inside. And it's that lack of understanding that creates a real vulnerability. And that vulnerability creates a direct path to believing misinformation. It goes like this. We don't understand the black box of medicine. That fuels a need for simpler, easier explanations, especially when we're scared. The internet is more than happy to provide those simple answers. This can even lead to conspiratorial thinking, which gives us a sense of control. And all of this creates what researchers literally call bullshit susceptibility. It's this readiness to accept oversimplified and often totally wrong information online just because it feels comforting and makes us feel like we're in control of something big and scary. Which, leaves us with a pretty critical final question. The black box of medicine might be complex and hard to understand, but what happens when, instead of trusting that, we turn to a different kind of black box? The social media algorithm. One that is literally designed to know our fears, to amplify them, and to profit from them. When the black box knows your fears, who do you trust?